Hi, my name is Nicholas Cohen. I'm a primary care doctor with a practice in downtown San Francisco. I created Health Score, which consists of 31 recommendations to optimize health and extend life. Today we're talking about recommendation number 1, be tobacco free. If you use tobacco, then this lesson is for you. I'm sure you've already heard that tobacco will kill you if you don't stop. The evidence is clear. Based on numerous trials, even a small amount of tobacco increases risk of premature death. And the more you smoke, the shorter your lifespan. For people who smoke for a lifetime, they're going to live 10 years less than someone who doesn't smoke. The good news is that quitting after age 35 can save you 5 years of life. And if you quit before age 35, your life expectancy returns to that of the general population, as if you had never smoked at all. What exactly is so harmful about tobacco? Tobacco causes death and disability in 3 ways, from cardiovascular disease, which includes heart disease and stroke, to cancer, and COPD, or chronic obstructive pulmonary disease. Tobacco causes heart attacks and stroke by vasoconstricting the coronary arteries. That means closing off blood supply to the heart. It also causes hypercoagulability, or increased risk of blood clots. Tobacco use causes cancer. We know that tobacco contains over 7,000 chemicals, and that's just in one cigarette. And that 70 of those 7,000 chemicals are known carcinogens. Tobacco causes cancer because it basically delivers carcinogens directly to your tissue. Those carcinogens get a direct route to your lungs, your esophagus, your liver, your breast tissue, your colon, your prostate. Tobacco use causes COPD, which is mechanical damage to the lung and destruction of lung tissue, which results in many being unable to tie their shoelaces without becoming short of breath. And eventually, many also require home oxygen just to breathe. So how do you quit smoking? I have 6 steps that I recommend you take if you use tobacco. These 6 steps are proven to be effective. I've helped thousands of people quit smoking just with these tips. Step number 1, challenge fatalism. I often hear from smokers, life is too short. We're all going to die. I'm going to have my cigarettes. Often it can feel like giving up tobacco is like giving up pleasure. But this is misleading in 2 ways. One way that quitting smoking is like giving up pleasure is a misleading concept, is that a smoker's life is not all that it's cracked up to be. The life of smokers isn't just fun and games and then you just happen to die 10 years before everyone else. People who use tobacco have lives characterized by progressive disability and suffering. They experience difficulty breathing, walking to the bathroom, develop cancers that lead to long-term pain and impairment, heart disease that leads to paralysis of limbs from strokes, or chest pain just from going to the grocery store. Indeed, the idea that smokers lead a hedonic and blissful life and non-smokers are in perpetual denial of some great pleasure is a little misleading given what we know happens to people who smoke over their lifetime. The other way that quitting smoking is like giving up pleasure is misleading is that quitting smoking doesn't mean giving up on the thing that causes pleasure from tobacco, namely nicotine. This brings us to step number 2. Step number 2, don't confuse nicotine with tobacco. The good news is that you can have the nicotine you enjoy without the death and disability caused by the additives in tobacco. I'm talking about nicotine, and I'm talking about many FDA products that contain nicotine. Nicotine is safe. It's not the problem. There's a safe way to get nicotine without the chemicals in tobacco. The key here is that you can continue to use nicotine, the thing you enjoy about tobacco, and give up all the downside of cigarettes. So if nicotine is all you desire, and who wants cancer, heart disease, and COPD that come with the rest of tobacco, then why not just choose nicotine? And you can. And this brings us to step number 3. Step number 3, use nicotine gum. I recommend you use nicotine gum. Nicorette Fruit Chill happens to be the most popular flavor I've seen with my patients. You can get on Amazon for about 31 cents a piece. You don't need a doctor's prescription. The way you use it is called the chew and park method. So you chew it a couple times, park it for a couple of minutes between your cheek and your gum. Then again, chew it a couple times, park it again. Repeat that until it loses the flavor. You should keep a piece in for about 30 minutes. The nicotine gum is absorbed through your mucous membranes. So if you just chew it the whole time, which you might be tempted to do because it does taste pretty good, you're going to just swallow the nicotine, which can cause upset stomach, and you won't get the benefit of the nicotine. You won't feel the nicotine. What you want to do is have it absorb through your cheek. The other key with using nicotine replacement is to get ahead of the urge. Nicotine gum can take 30 minutes to reach the blood-brain barrier and be felt by the nervous system. On the other hand, if you inhale a cigarette, it takes 7 seconds to reach the brain. So if you wait for a stressful event to happen, expecting that the gum will give you that same quick relief as a smoke, you're going to be disappointed. You're not going to have the immediate relief you did when you smoked a cigarette. The goal here is to have the nicotine in your system from the gum before those events that cause stress that lead you to smoke. In the first 6 weeks of using this gum, I recommend having a new piece in your mouth every 1 to 2 hours throughout the day, really going for a goal of 12 pieces per day. If the gum fails for you, and it doesn't work for everybody, then I recommend you ask your healthcare provider for other options. There is combined nicotine replacement therapy. That would be taking the patch and the gum, or the patch and the lozenge. And that's actually something you can get over the counter as well. It can be a little more complicated, so you might want to talk to your healthcare provider before starting that option. 2 other options are prescription medications, Zyban and Chantix. These options are more effective than gum alone and might be appropriate for you if you fail to have success on either the gum alone or the gum and the patch combined. I do recommend you talk to your healthcare provider, though, as these medications require a prescription. Step number 5, don't stress your quit attempt. If you fail to quit, join the club. It takes people at least 5 attempts to be successful when they're trying to quit smoking. So each so-called failure is really an opportunity for you to learn what doesn't work and to pick up and try again. Each failure is really just a step closer to success. And finally, step 6, accept the challenge now. There is never too little tobacco. A common response I hear when I recommend people quit smoking is, I'm not addicted. I have only 1 cigarette a month. Or I just like to lace my joints with a little bit of tobacco. But there is no safe amount that you can ingest in your system. So no matter how little tobacco you're using, this recommendation is for you. As recent studies have shown, and as I've alluded to, even 1 cigarette per day increases risk of heart disease, cancer, and COPD. So this recommendation applies to you, no matter how little you're smoking. And there is never a better time to quit. The other common response I hear when I advise a person to quit smoking is, I'm not ready to quit. I'm under too much stress right now. Maybe I'll try when my kids go off to college, or maybe I'll try for my New Year's resolution, or maybe I'll try when my boss retires, or maybe I'll try when I retire or find a better job. Maybe I'll try after I lose weight. The fact is that now is the best time to quit. Life will always have stress. It's not about waiting for a time when there is no stress. It's about accepting that life will have stress and understanding that quitting tobacco means just replacing tobacco with a nicotine product that doesn't have any of the downsides. You'll be keeping your strategy for handling stress, nicotine, but kicking the cancer, heart disease, and COPD that are the side effects of tobacco. I hope this video helps. I hope this video helps you quit smoking. I wish you luck in your attempt. Thanks for listening and good luck.